I'm Jane, and this is the CareSmartz360 Bulletin. The CMS announced a new initiative aimed at strengthening program integrity in the hospice sector. The Fraud Tax Project seeks to curb fraudulent billing and tax evasion schemes tied to unscrupulous hospice operators. In a letter to the U.S. Department of Health and Human Services, CMS Administrator Dr. Mehmet Oz outlined a collaborative approach that brings together CMS, HHS, and state tax authorities. The goal: identify patterns of billing and tax data that signal fraud, and take swift action against operators engaged in both healthcare and tax fraud. Pursuing tax fraud cases provides state authorities with a faster, more direct path to enforcement than traditional healthcare fraud prosecutions, Dr. Oz wrote. He said that convictions in tax fraud cases can enable rapid revocation of billing privileges, cutting off fraudulent activity, and protecting taxpayer dollars. Fraud is not only a financial offense, it is a moral one, he added, calling for teamwork across government levels. Governors nationwide have been notified of the initiative. The plan envisions a joint effort among CMS, HHS, and state tax agencies to detect red flags in data that could point to fraud. CMS describes the effort as building a powerful, mutually reinforcing system to safeguard program integrity and public funds. CMS notes a troubling pattern. Operators who submit false Medicare billing claims often fail to report the corresponding income on their tax returns, creating a dual-layered crime that strains both federal health programs and state tax systems. The agency expects the initiative to lead to a wave of enforcement actions, including expedited administrative steps to strip fraudulent providers of their billing privileges after state tax convictions. Anticipated outcomes include identifying and prosecuting a significant number of Medicare providers and suppliers for tax evasion, and using tax data and investigative insights to bolster Medicare oversight and protect taxpayer funds. The new project adds to ongoing efforts to root out hospice fraud, which regulators say has included cases of claims for services never delivered, care not medically necessary, or schemes involving kickbacks for referrals, and enrolling patients who aren't terminally ill. Industry observers have pointed to the broader integrity challenge facing hospice care, with rapid growth in some states, license practices like license flipping, and concerns about access, quality, and sustainability. California, as well as Arizona, Nevada, and Texas, have drawn particular scrutiny in recent years, with officials citing rising program integrity concerns and a spike in fraudulent activity tied to new hospice programs. CHAPCA's president and CEO, Sheila Clark, praised the initiative, saying tax enforcement can expose scammers quickly and decisively, and highlighting California's experience as a warning and a roadmap for national action. Holly Vossel, senior reporter for Hospice News, notes that the industry will be watching closely as this cross-agency collaboration unfolds and as states begin to leverage tax data in pursuit of fraudulent operators. That's all for today in the CareSmartz360 Bulletin. Until then, have a great day.